You are watching The Convo with Dr. Fridah and James Wetu. Convo, encouraging conversation that matter.
Hi guys, welcome to Convo, encouraging conversations that matter. I trust that you had an awesome week. My week was amazing and I'm so grateful to God for the opportunity to do this again. This is the doctor's bench where your health is our priority. I am so glad today because we have a special topic. We have done this program. This is that time now, the second time. The last time we did a conversation on mental health, specifically postpartum depression with our psychologist Rosalind, and the other time we did mental health in the church with our psychologist Margaret Monene. So today we're going to do something different, so please sit down and enjoy this conversation. It's a conversation between you and I, so I am expecting your questions, your concerns, your comments, your complaints, everything. Please put it down as a comment. I will make sure I respond to each one of you. The latest development we've had in Convoy is we created a WhatsApp Facebook group for the Doctor's Bench. The Facebook group is called Doctor's Bench, and so many of you have joined, and we have been having amazing conversations there. People are asking questions and others responding to them. You guys are so funny. The question I asked that made me think of this program was, what is the most weird question that your doctor has ever asked you? And so many people giving their comments and experiences with their doctors, and I was so glad to read through those questions. And I sat down and thought to myself, wouldn't it be easier if we all knew what to expect when we are going to visit a doctor? Because sometimes we go to the doctor just because we are feeling sick, and we leave the doctor's office without feeling like they addressed our concerns. So this is why I am doing this program now. So today's topic is, how do I get the best out of my doctor's appointment? The Bible says in Hosea 4:6 that my people perish because of lack of knowledge. You go to the doctor's office, you pay your money, but then you leave and go home and you don't feel satisfied with that appointment. So that is why I'm here. We want to avoid such things from happening. So please, I am waiting for your comments. I'm waiting for your contributions, your experiences. Share your experiences with me. I would like to know what was, the most weird thing you were asked by your doctor, And if you have not joined our Facebook group, the Doctor's Bench, please do so after this. I will make sure I put a link in, this video so that you can do so after this program. So also, if you have not subscribed to our YouTube channel, please do so now and hit that notification bell so that every time we upload a video, you will be notified. Thank you so much for your support. So, when I think of the doctor's visit, everybody gets anxious when you're going to visit a doctor. And I pray that none of you will get sick, but I'm just doing this video so that in case you find yourself in a situation where you have to visit the doctor, or in case you need to take your loved one, maybe your child or maybe your relative to the hospital, you will know what to do so that when you leave that place, you will have gathered all the information that you need, and you will have left that office feeling confident that you did not waste your time. So I want to share 7 tips, and I will be quick, and I'll make sure that I share it as a blog as well in my website, fridahwachiraonline.wordpress.com, so that you can read more details about the tips I share. So please also follow my blog so that you also have more information. So the first thing I would like to say is I find it very sad. When I was in my 3rd year of medical school, that is the year we begin our clinical rotations, and as usual, a third-year student, you can always trace a third-year medical student in hospital because they're always roaming around the corridors looking for interesting things to do. So this one time, an old lady stopped me, and she had her hospital records and cards, and she told me to explain to her what was written down by the doctor. Then I went into a conversation with her and asked her, what did the doctor say? Because as usual, the handwriting that was on that card was not very legible. So she told me I did not understand most of the things they said, but they said I should go to the pharmacy and buy this and this, but she wanted to know what exactly is wrong with me. So I felt that experience made me feel like we are not getting the best out of our doctor's appointment. And even if some of us are, but most of us are not. And I think we are past the regime that doctors should not be questioned. It is okay to question your doctor. A good doctor will feel confident that their patient went home with knowledge of what's ailing them and how to go about it. So the very first thing I need you to know is you should always be prepared. Now, unless it's an emergency, you can't prepare for an emergency. But if you're going to see a doctor, maybe you're going to have your tooth removed or, have a root canal, whatever. If it's an appointment you had made, you have time to prepare. And by preparation, this is what I mean. I don't mean you go and look for articles and read about your condition so that when you go to the doctor's office, you're, hitting them with all these jargons. No, that is not what I mean. What I mean is have time to prepare. Identify a health facility that is near you, or the health facility you want to go to, and get information about that facility. For example, what time does the doctor come in? If you're hoping to see a consultant, you should know what time the consultant comes in so that you're not waiting for 4 hours for the doctor to come. And if you know there are queues, you should know so that you go early enough so that you're not behind at the queue. So if you should also know how to go about your health insurance in that facility, such things. That is why I'm saying if it's not an emergency, you definitely have time to prepare. So what happens is if you're looking for a certain consultant or a certain specialist, you may not sometimes private facilities don't have all those. So if you're not sure, it is good to go to a public facility, like maybe a level 5 facility, because the likelihood is you will get a specialist there, or if they don't have a specialist, they make sure they connect you to one. So that is why I'm saying the very first thing you do is be prepared. Do not just wake up and go. Put in a little bit of thought about, what kind of an appointment is this, or, you need to know if the hospital you're going to, you need to book an appointment prior. Like in some facilities, if you want to see maybe a gynecologist, you have to go to the outpatient first, and then they will book you for the next gynecology appointment. So know in advance what you need to do before you get there. The very second thing you need to do is be your own advocate. I think this is the most important thing for you to do when you're going to visit the doctor. And why I'm saying this is because sometimes we or the doctors have been accused of not being compassionate enough or considerate enough or enthusiastic enough about the conditions that patients are having. But sometimes you also need to understand that you're probably not the first person that doctor is seeing that day. They have probably seen a lot of patients. They are probably tired, exhausted. Some of them have been in the night shift. Some of them have been overworking, and sometimes it's not their fault. But this is not to mean that I'm making an excuse for any doctor. What I'm saying is, if you don't engage your doctor, they are probably going to think you're satisfied. So if you have concerns, please make sure that you know what you expect. What is your expectation? If you went in with pain, you expect that at the end of that visit, your pain will be handled. It will be addressed. You have, they will write you a prescription that will address that pain. If you went there with a condition that you don't understand, you expect to have a diagnosis at the end of the day and a management plan. So if you don't have an expectation, you just go and the doctor will write down some prescription and give you back that paper until you go to the pharmacy or, get a refill. And that's it. So if you don't engage and air your concerns, or sometimes it's good to also have some background information. Like if you have a certain condition and you need to find out what is it that I need to know from my doctor. Sometimes you'll be on medication for a long time. You could ask, what do I need to do, or what even nutritional advice, like what nutrients do I need most with my condition, Ask questions. Do not be afraid to question your doctor. I tell that to people all the time. Do not be afraid to question your doctor, because your doctor is ready to answer all your questions. Most of the time, maybe the maximum amount of time you spend in the doctor's office is 15 minutes. That is maximum. And that is that doesn't happen a lot. If you find a doctor spending 15 minutes with you, maybe, I don't know. But for you to have the most, to get the best out of that time, you need to have an expectation and be your own advocate. If you're taking your child to hospital, you have to be that child's advocate. Don't just sit there and nod and agree with everything you're told. You have to ask questions. When the doctor says your child has this and this, you could even ask, so what caused it, so that if it's something that you did, you will not repeat it again. So it is important to be the patient's advocate. If you're a caregiver, if you're taking a loved one to hospital, they are probably already anxious, so you have to be the calm one and be the advocate. Ask the questions and get answers. Raise concerns. You could say, maybe if you came to the doctor for a second opinion and they said the same thing the previous doctor said, it is okay for you to tell them, I feel like this drug they gave us last time was not helping us, and it's the same drug you've given us. So maybe you can consider giving us a different drug, or is there something different that we can do for this patient? If they have a symptom that is not going away, ask about it. Be your own advocate. Do not be afraid to ask questions. Never be afraid to ask your doctor questions, because at the end of the day, the goal of that doctor-patient relationship is to address what brought you to hospital. And the very first and most important question the doctor asks you is, what brought you in today? So that is where you step in and give the most pressing concern. Don't start with what happened in 1950. No, just say, I have had this pain. It started when it started and all that. So it is very important for you to know that when you step into that office, you're your own advocate, and your doctor is not likely to engage you in a very deep conversation. So it is up to you to ask the questions. So number 1, I said be prepared. Number 2, I said be your own advocate. Number 3, I said be honest. This is very important. If there is anything a doctor appreciates from a patient, is honesty. In one of the comments of the question I asked in the Facebook group, someone said that another patient was asked, do you smoke marijuana? And the patient asked, does it count if it was just one puff? That is an honest patient, and I think that is the most important thing. If the doctor asks you about underlying conditions, please just tell them if you have any underlying conditions. If you have been using any drugs or over-the-counter medications, please tell your doctor. When they ask you, have you been on any kind of medication, do not assume that the medication you bought from the chemist is not included in that question. So be honest with them and tell them, yes, I have been using this and this and this, and is it helping? You can tell them it's not helping, or it helped a little. If you have also used herbal formulation, it is also important to let your doctor know, because some herbal formulations interact with the drugs your doctor might prescribe to you. So it is important for you to tell them. If they ask you about drug and substance abuse, this is the question people run away from, and some people get offended. In my response to some of those questions, I said, do not get offended, because the doctor does not know your personal life. Most of the time, the doctor does not know anything about your personal life. So they are not asking you because they are interested in your personal life. They're asking you because they are interested to help you get better. And the way to get you better is to know everything, every single detail. So give them the information they ask for. If they ask you if there is a family member who has a certain illness, I've seen people hiding mental illness. If they have a family member who has a mental illness, they tend to avoid mentioning that to the doctor. And the doctor is not there to embarrass you. You should know that the doctor is not there to embarrass you. Some people even lie about traveling. The doctor will ask you, have you traveled to any place recently? And then you're there saying no, and you're probably in a malaria endemic zone, and the doctor would have made a diagnosis easily if you just told them that, yeah, I went to this and this region, I came back, So do not dismiss any question your doctor asks you. Every question they ask you is important. Even your family history. Even if they ask you about your siblings whom you don't like, do not, the doctor is not concerned that you don't like them. He's concerned if there's anything that could be running in your family, and if you expose such information to them, the doctor is able to know that you are at risk for this and this, and they will give you information on how to avoid that condition. That is why I'm saying be honest. It is very, very important for you to be honest with your doctor. If they ask you about your pregnancy status, do not lie about that. Do not feel embarrassed. Please just tell them if you're sure or not. Just say it as it is. The other thing you need to do, still on the point of honesty, is don't exaggerate your symptoms. I know people, some people exaggerate their symptoms, and some people dismiss their symptoms. So you find someone who is having a very severe headache saying, they are being a man. There's nothing like that. It's not helping you. It's not helping your doctor. So if you have a very severe headache, just say, I have a very severe headache. The other thing you need to do is don't try to use jargons with your doctor. If you're having a headache and you feel like someone is hitting you with a hammer from the inside, just say it like that, whatever you feel. However, layman it sounds, just put it as it is. If you're having a stomachache like that, feels like someone is pulling your intestines out, just say it like that. Leave the jargons to the doctor. They will figure out what to write and what to derive, and what that implies. So do not use jargons with your doctor. If you're feeling lightheaded, if you're feeling kizunguzungu, just say it as it is. Be honest. That is very, very, very important. The other thing is, carry as much information as you can about your health history. Why I say this is, most of the time the doctor will ask you, have you had any surgeries in the past? Have you had any food or drug allergies? Have you had a blood transfusion? Have you ever had been treated for this and this condition? Is there anyone in your family that has a chronic illness? So if you don't know some of these things, you will not be in a position to answer them. And sometimes if you're going to see a specialist, most likely you have passed through other doctors before. So there are tests that have been done. There are prescriptions that have been written for you. You probably have a lot of scans and all that information with you. So what you do is carry those scans with you to the hospital. If you have medications you're using, don't just cram the names and go tell the doctor, because some of these names are just brand names. So carry those medications with you, pack them nicely in your bag, and when you get to that point and the doctor asks you about, have you been using any medications, have you had any allergies or whatever, have you had any scans, any blood transfusion, just give them those drugs they ask for, and they'll be able to tell from that there where to begin. Because if you don't know what scan your last doctor ordered for, and this other doctor needs information from that scan, they are likely to order for another scan. So it is important for you to carry your test results. If they had, maybe they tested your blood for something, just carry them, even if it feels like it's not important for this consultation. Carry them with you, so that in case your doctor says, I would like to order this and this test, you'll tell them, I have this test with me. If this was done a week ago, so that they don't have to repeat it, they can use it to make a diagnosis and decide on the management plan. So it is important for you to know about even the underlying conditions that you have. Even if it seems like something, maybe it's something that has been ailing you for a very long time, do not assume that this is not important because what brought me in is a headache. It's not diabetes. That is something I've been managing. So today I was brought in because I came in to see a doctor because of diabetes, because of a headache, sorry. So don't assume anything with your doctor. Just carry those things with you. I have seen some people have plans. Some people have plans from other, what we call complementary medicine or alternative medicine. Just carry it with you and be honest with the doctor. Tell them, I've been using this plan. I think it's been working for me, but when they ask you about what other medications you've been using, just take it out and tell them, I have been using this plan. And I know that most people don't do that because they think their doctors are against these kind of medications. But it is important for your doctor to know that you've been using these things, so that if they are going to give you any other medication, they will give you something that does not interact with them. Or if they think it's harmful, they will explain to you why you should not use that kind of medication. So the fifth point is have some company. I know this is not ideal that you go to hospital with someone else. But if you are the anxious type, sometimes some people get too anxious when they visit the doctor's office that they forget even their symptoms. So if you're not the kind that needs company, you can also have a symptoms diary. You can like just note down a few things, so that once you leave the doctor's office, when you step out of the door and remember, I forgot to tell the doctor about my toe. My toe has been, my toe was hit or something, or has been bleeding, or my nails or something. You can't go back in because they already have another patient. So that is what I'm saying. If you're the anxious type, you can have a symptoms there. You can note down all your concerns, so that when you are in that doctor's room, you will air all your concerns. So if you don't mind company, it is important, because when you have company, what you have is an extra set of ears. And if you're going to see a consultant and maybe God forbid that they're breaking bad news, they might also, after they break the bad news, some people freeze, or a lot is going on in their minds, they're not able to process. So whatever the doctor says after delivering those news is not, it falls on deaf ears. So when you have company, the person you accompanying that is accompanying you can listen on your behalf, can listen to the doctor on your behalf, and can ask questions. And it is important to have somebody who is empathetic and positive, because if you carry someone who is negative, that would not be of much help. So carry someone who is composed and positive and empathetic with you to the doctor's office. You can also, if you're not able to what do I call it? If you're not able to tell the doctor what you're ailing from, you can ask them to speak on your behalf. But if you're confident enough, just carry a symptoms diary and be composed as you talk to your doctor. So sometimes we let our loved ones go to hospital just by themselves. We don't even, you assume that they'll be fine. If this is someone who has a chronic condition, it is important for you to step in. That is why this point about company is very, very important. You should step in, so that if there are instructions, like for example, if there are a diet plan the doctor needs for them to follow, if there's a certain prescription that they need to take, maybe before meals or after meals. Sometimes you find patients who have like 5 drugs they need to take, and that can be too much for them, too much pressure. So if you are the person accompanying the sick person to hospital, make sure you also listen and ask questions. Number 6, think about what you wear. I know this seems like it's a bit off my point, but it's very, very important. Ladies, this is not the time for you to wear a jumpsuit. When you visit your doctor, do not wear a jumpsuit or anything that is too tight, because your doctor might need to examine you, and it's going to be a hassle if you have a jumpsuit on, because if they need to examine you will have a hard time trying to expose the areas they need for you to examine. Or if they need to deliver an injection, I know most of you don't like that point, but if they need to deliver an injection and the kind of clothes you have don't allow for it, then you're going to have a very, very hard time. Just wear something that is comfortable, and you'll be good to go. Then the last point is relax. I think this is the most important thing. Studies have shown that sometimes when blood pressure measurements are done in hospital, for most people it tends to be higher than when it's done from home. And this is just because I know that being in hospital alone can make someone very anxious. So what you do is just relax, be composed, be free. Don't before you get into that doctor's office, don't start running all the case scenarios in your mind. That will just get you worked up and very anxious. And when you get anxious, you tend to be forgetful. So when you forget things, you leave that doctor's office not having your concerns addressed. And that is what we are trying to address today. So be calm, be composed, explain to your doctor slowly, even if it feels like you're in a hurry, the doctor is in a hurry, just tell them, I have this and this and this. Explain to them without leaving out information. Don't let if the doctor is writing too fast, the doctor can be writing too fast and you're thinking, what, this doctor, or if there's a very long queue and your mind is telling you, hey, what about those other patients? Remember, you're there because you're sick. So what you do is address all your concerns, and you always start with your most pressing concern. Don't start with in 1950, when I was carrying a sack with my grandma, who is not there anymore. So if you start there, then it's going to be a very long story, and you're going to miss out on, the doctor is going to miss out on the important things. So don't panic, don't panic, because you need to have all the details right. You need to know that I'm going to see the doctor because of this and this and this and this. But when you panic, you can easily forget a lot of things. So those were my 7 points. So be prepared, be your own advocate, be honest. Yes, this is very important. Carry as much information about your health history as you can, as much information as you can. Then consider having company with you. Think about what you wear. Then the last and the most important is relax. So that is it for now. Just a kind request, if you have not joined the Doctor's Bench on Facebook, it's a Facebook group, it's a private group. In that group, you can ask your questions. If you have any health concerns, you can ask them there. We have a team of professionals that are also part of that group. We have people who are ready to grow and learn about their health. People are ready to live healthy lives. So you can ask your questions there. If you have blogs about health, not mental health in general, you can share them also in that Doctor's Bench. If you have you need recommendations on health facilities or specialists, you can ask all those things there, and we will be glad to respond to all of them. So please join the group, ask your friends to join, and don't forget to subscribe to our YouTube channel. We will have Doctor's Bench again next month in the 3rd week of May. So God bless you. From me for now is a shalom.